Hi, my name is Dr. Tran and I'm a doctor on the virtual COVID ward. A lot of people with coronavirus don't need to come into hospital and most people will get better on their own. The virtual ward allows us to take care of you remotely in the comfort of your own home. Because you have coronavirus, it is very important that you stay at home and if possible also isolate from other members of your household. In order to keep you safe, we've given you a device called a SATS probe, which allows us to measure how fast your heart is beating and if there's enough oxygen in your blood. These measurements help us to work out whether you are safe enough to stay at home or whether you need to come into hospital. To use this device, remove any nail varnish, sit down and rest for a few minutes, make sure your fingers are nice and warm, and place the device on your finger like this. Turn it on by pressing the button and wait for the numbers to appear. And then wait until they stop changing. This might take up to a minute. Once the numbers have stopped changing, make a note of them. Then we want you to do a walking test. Get up and walk 40 steps, then immediately take the readings again and make a note of those numbers too. We would like you to take these readings 4 times a day. We will then call you every day to discuss your readings and give you any advice or help that you might need. If it seems like things are getting worse, we can always bring you back to hospital straight away. There are several different devices that look a little different from each other, so I want to show you a couple of different ones and how to read them. The devices with the red display can be a bit confusing because the numbers could be upside down. The key is to look at this bar. It should be going up and down away from you like this. If it's coming towards you like this, press the button to turn the display the right way up so you can read the numbers from where you're sat. The number next to the bar is your oxygen level. The other number is your heart rate. On devices that look like this, the number next to where it says SpO2 is your oxygen level and the other number is your heart rate. If you feel more breathless or your symptoms are worsening, please seek medical attention. You can call our virtual ward on the number on your leaflet, or if you can't get through, call 111 or in an emergency, dial 999. We need these devices for other patients, so once you've fully recovered, please return them to the hospital. We recommend you keep the device for at least 2 weeks after you feel better, just in case your symptoms return. Thank you for helping us. Take care of you, and all of us on the virtual ward hope you get well soon.